I will send a message to Kamar Bhai.
Okay. Perfect.
अस्सलाम वालेकुम।
वालेकुम अस्सलाम। कमर भाई क्या हाल है आपके? खैरियत से?
सब ठीक है, अल्लाह का शुक्र है। आप सुना सब ठीक ठाक?
अल्हम्दुलिल्लाह। ये आप अपने बैकग्राउंड वाला हटा लें तो ज्यादा बेहतर रहेगा।
अच्छा, जहाँ मैं बैठा हूँ वहाँ पे काफी कचरा जमा है।
अच्छा,
ये
क्योंकि
मतलब जो वर्क कंप्यूटर है तो उस पे
अभी
जब
ऐसे शो कर रहे हैं जैसे बहुत तेज हवाएं चल रही हैं, आपके बालों को इधर उधर लेके जा रही।
अच्छा, इन्होंने जिस तरह बनाया हुआ है, मेरा ये एक्चुअली हम लोग जो लेक्चर्स देते हैं वो वाला कंप्यूटर है, इसलिए
ठीक
काश
है,
आराम से
चलेगा
कर सकता।
चलेगा।
थैंक यू। Are we hearing some ambulances in the background, I think?
Yes.
This is near my house.
All right, okay.
Let's start.
Perfect. Dr. Mazam, if you would like to begin, inshallah, then everything's ready to go.
Okay. Bismillahirrahmanirrahim. Assalamu alaikum, everyone. My name is Syed Hussain Zaidi, and I am member of IMI EU Board of Directors. On behalf of IMI, I would like to welcome you all in today's webinar organized by IMI. Before we start the webinar, first of all, I would like to offer our condolences and strongly condemn the brutal and senseless killing of minors in Mach, Balochistan. IMI stands with our Hazara brothers and sisters in the wake of these recent killings. IMI has set up an emergency aid campaign to help support families of the victims. You can find the details on IMI website as well as IMI Facebook page. Can I request you all first to recite a Fatiha for all the martyrs before we start our program, please?
Bismillah. Bismillah. Allah. Allah.
Okay, so we have a very distinguished panel of speakers today, and inshallah, we all will be benefiting with their presence. The purpose of these webinars is to create the awareness among our communities and for general public. As we all are aware that the pandemic is again taking its peak, the number of cases are rising, and there are so many things which are not communicated in a way that helps and benefits our people, because there's a lot of misinformation, there's a lot of propaganda against certain things. So we are trying to solve and address few myths here, so that our people can get right information, and if they want to say take some decisions, let's say in terms of vaccinations, then these all are informed decision. So it will be a interactive session. You can ask questions, you can send questions in Q&A section of the screen, or you can send in the chat as well. We can have some questions at the end. So first of all, I would request our Honorable Maulana Dr. Syed Abbas Naqvi Sahab, who is Trustee and General Secretary of MENAB, Trustee, Finance Secretary, and Central Coordinator of Majlis Ulama Shia Europe, and is also a resident alim at Al Asr Center, working in Surrey. So I would like to request Maulana Sahab to talk about our responsibilities and how do they see our role as a community, as individual, in preventing the spread of the virus, as well as how we can help each other. So over to you, Maulana Sahab.
Assalamu alaikum wa rahmatullahi wa barakatuh. A'udhu billahi minash shaitanir rajim. Bismillahir rahmanir rahim. Wa man ahyaha faqa'annama ahya an-nas jami'a. I would like to extend my condolences towards Shuhada of Mach Hazara tribe from Quetta. May Allah subhanahu wa ta'ala raise their level, grant them Jannah, and bless us with the blessing of blood of Shuhada. But that was a positive point worldwide for all of us to awake, to stand, and to bring awareness among the mankind. As Allah subhanahu wa ta'ala has said in Quran, anyone who is going to protect one person, one life, that is equal to protecting life of all mankind. So those who have been killed brutally, those coal miners who were earning bread and butter for their family members, for their kids. The history of 14 centuries, the history that was started in Karbala, has been repeated again in much. People can't see their photos. But again, Allah subhanahu wa ta'ala has said, anyone who is martyr, who is shaheed, is alive. So they are alive, we are also alive. We are lover of Muhammad wa ali Muhammad alayhi salam. We all have our duties, responsibilities towards ourselves and towards the rest of the mankind. Our body is aman of Allah subhanahu wa ta'ala. We didn't buy our body ourselves. Allah subhanahu wa ta'ala has granted us this life, and He has taught us the uses and misuses of our eyes, our ears, our tongue, our hands, our thoughts. So if we are working and going on right path, following and obeying the commandments of Allah subhanahu wa ta'ala. So we are in line and length of Tawheed, and we are working as Allah has commanded us to use our body. But if we are not taking care of our body, our organs, and intentionally we are going to damage, we're also involved, or we can say this is suicide. We're also damaging ourselves, killing ourselves. Likewise, through our words, through our medicines, through our foods. If intentionally we are making something and giving to the people that is going to damage them, so we are involved in their murder. So as a whole, we need to purify our thoughts and our actions. We are responsible to protect our body, our soul, our existence, as well as we are responsible to protect the rest of our neighbors, our community members, and the mankind. And Allah subhanahu wa ta'ala has highlighted, if you are going to protect one person, imagine how great the great work you are going to do. Allah is saying, I am going to appreciate. You have protected all mankind. So the 2020 last year, that was really difficult for all mankind, for all of us. That was challenging for all of us. That has changed the world, thoughts of world. Different projects, different businesses, different things, everything was affected. So there are different rumors. Some they say this is man-made, and some they say no, this is by nature. But what is the reality? Reality, we human being, we are going to be contacted, infected, and we are being died. Allah subhanahu wa ta'ala, from Adam to Hazrat Muhammad Mustafa sallallahu alayhi wa sallam, so has taught us the wisdom, has produced different plants, different ingredients to cure whenever we are going to suffer with different diseases. He has granted us wisdom. He has granted us knowledge. He has granted us sciences. And then as a Khalifatullah, Khalifa fil Ard, we need to explore. We need to find out what is proper thing for the treatment of a certain disease. So the first thing that is important thing, that is we need to be careful about our immunity. We all need food. We are eating different kind of food, but we need to be prepared and careful. Those things like vitamin C, like vitamin D, different foods which are helpful to improve and increase our immunity against this COVID-19, we have to use. Our family members, our community members, we all, prevention is better than cure. So the first and important step to protect ourselves is improving our immunity. Different foods, different habits which are good for our health, for our immunity, we need to do. This is first line of our defense. The second line of our defense, that is getting vaccinated. And vaccines are not new in the market. So in the past, many people, they died due to polio, diphtheria, tetanus, tuberculosis. But scientists and doctors, they invented different vaccines and medicines to cure, to protect the mankind. And today, day and night scientists, they worked. They developed a vaccine. and 3 types of vaccine have been introduced in UK and Europe and other countries. One has been made by Pfizer, the other one is known as Oxford, the third one that has been approved in UK, that is Moderna. So none of these 3 vaccines are going to have any animal ingredient like pork or other things. And our religious authorities, they have also commanded us, they have taught us, so something that is going to protect our life, we have to use. We should, but ultimately this is the choice of person, whether an individual is going to take that vaccine or not, but as well as medicine, science, and the religion is concerned. So all are supporting your health, your life. They are concerned. We are concerned. We want to see you alive and healthy. We don't want you should be suffering on the bed. Those who are facing COVID-19 and when they are serious, when they are having fever, when they are having cough, when they are having different digestive problems, really it is really difficult to survive and to live. And especially those who are going to end in hospital, they are on ventilator, it's not easy. So doctors and the government and different authorities who are linked and related with the safety and health of people, so they have decided for your health. So as a whole, this is our duty, religious duty, moral duty, ethical duty. We should try to improve our immunity. We should try to take vaccine to save our life and protect from this virus. And also, if we are getting protected, so at least the person who has been vaccinated is not transferring that disease to other human beings. So we should think about others. We should protect our family members. We should protect our community members, and we should try to protect the mankind. I hope we all will try our best to have healthy life, and also we will think about others who are suffering. Those who are suffering, really many countries which are poor countries, people are suffering, they lost their jobs. So even financially, if we can help them provide, especially the person who is suffering, so for 2 weeks, really it is difficult to cook food, to make food. So we need to help each other, even on phone, providing different things which are necessary for their life, inshallah. So rest of my panelists, so they will also speak about the topic. So I am at your service as well. Thank you very much.
Thank you, Maulana Sahab. You have made some really important points, and inshallah we all can benefit from them. At this point, I would just like to ask you a question. I think that one of the challenges we have been facing throughout this pandemic is misinformation and how people have been misguided. As Allah Ta'ala has said in the Quran as well, that ask the people of knowledge if you do not know, or verify about the news before you pass it on. So could you just elaborate and just say a few words about the importance of one spreading the information without verification, and then how our religion actually guide us about these things?
As I mentioned a few minutes ago, Atullah Sistani, so some people ask questions whether we have to get vaccine or not, we should get vaccinated. So he said, yes, you can get the vaccine. So Shia ulama, Sunni ulama, so nobody is going to oppose getting vaccinated. So as well as the religious authority, they are concerned. So they are satisfied. So nothing is haram in this vaccine, and nothing is going to cause any genetical changes or DNA or other things. And it is not a new thing. You know, if it is just controlling your mind, reading your mind, so already anyone who is using social media, who is using computer, so one day you are going to see one movie, or you are going to see one item. So next day you will find, the same day you will find many other items like that item. So this is brain reading. So already they are doing. So when we are using, so if we say, oh, I am not happy to use phone, I'm not happy to use a computer. So then I can't work today. So these are the things which are part and parcel of our life. Yes, again, we have the control. It is in my control, I should watch something or not. So we need to educate ourselves. Anything that's harmful for us, we should never go for that. And something that is useful, increasing our wisdom, increasing our knowledge, so we have to use. So vaccination, it is not a new thing that is coming in the market. So we can say 40, 50, 60 years back, there was vaccine people were using, so medicine people are using. So this is not a new thing to control the mind of Muslims or remove some kind of good values from the people. So religious authority as well as the science. Yes, people, they are having different kind of rumors, conspiracies. So everyone can think, but at the same time, we need to bring the logical support behind that idea. So nowadays, any vaccine or any medicine we are going to use, so anyone who is producing that medicine, giving whole list, what are ingredients, what are benefits, what are side effects, who can use, who can't use, so everything is there. Again, it depends on the person. It's personal choice whether that person is going to use or not. Otherwise, generally, totally, these vaccines are good for the mankind, and nothing is haram included in these vaccines.
Jazakallah. Thank you, Maulana Sahab. You have explained it very well. Thank you. So next, I would like to invite Dr. Syed Abbas. Kamar Bhai, he's a medical director and consultant in palliative medicine at St. Clair Hospice in Essex. He's senior clinical tutor, University of Cambridge, also associate lecturer, University School of Medicine, Anglia Ruskin University, and is also principal investigator in various projects by National Institute of Healthcare Research. And I am very much aware of some other roles of Kamar Bhai and how much he's involved in different community works, and throughout pandemic, how he has been supporting different groups and different centers with the different things to do with the pandemic. And also, Kamar Bhai is really a source of inspiration and guidance for many of us. So inshallah, we will be listening to Kamar Bhai, and I think he will try to address some of the myths we have been listening throughout the pandemic about the COVID. Thank you, Kamar Bhai.
Thank you so much for this kind introduction. And thank you very much for giving me the opportunity to be here and discuss some of the things about it. I intend to share some slides. So I think what I'm going to do today is actually give a background of where we have come from and where we are right now and where we'll be going, hopefully. And my background, as you kindly explained, is more about the medicine. So actually, all of this pandemic took a lead in looking after COVID patients. If you remember, when the first wave had hit, we had so few resources up our sleeve that I had to get involved with my palliative care head very quickly. As the time has gone on, my role is much more about managing the resources and actually getting together in the community care homes as well as hospital. So I'll just take some benefit from that. What I'm going to do is actually just share my screen and just go through some slides. So I hope that will be better than you seeing my face all the time. So let me start with some background. As I'm sure all of you would have heard about it and maybe a lot more than what I'm going to say, but I'm just going to set some scene here. COVID-19 was born out of coronavirus. And as we all know that the first case was registered firstly in November 2019 in Wuhan in China. And from then onwards, initially was declared endemic in the same region. Then it was FEAC, which was the public health emergency of international component. And then it became a pandemic later on, late January, early February, which meant that in one form or the other, it will be around most parts of the world. Now, within a year or so, we have seen 89 million cases around the world. The last stats show us that, with 1.928 million deaths. If I speak in different words, it's 19,28,000 people who have succumbed to either COVID directly or their underlying diseases were made complicated by COVID. In UK, we have now seen more than 3 million cases and 80,000 deaths again with COVID, which meant that either they died because of COVID or their underlying disease got complicated because of it. Today, as I understand, the SITREP, which is a situation report which is sent to the medical directors every day, 32,000 people in the hospital, more than 32,000 people in the hospital in the United Kingdom are due to COVID, are positive to have COVID, and they are having inpatient treatment. And more than 3,000 are now on ventilators. I think if we just ponder on some numbers, I think quite often people talk about that we are talking about 3.0 million cases and so few are in the hospital and so few are on the ventilator. Well, actually what we also need to remember that COVID is not just about the death. I was diagnosed to have COVID on the weekend of 17th April and I required quite some treatment. And for 6 weeks I was off. And even after that, when I had gone back to work, the consultant colleague who basically also from Karachi, he actually referred me to long COVID clinic. And the workload is so high in long COVID clinics that I'm not able to see anybody till March. So this is the burden on the healthcare is very quickly increasing. So how does it start? Now, another thing about coronavirus, how long have we known about coronavirus? Actually, the first time coronavirus was first picked up was 1930s. But in 1930s, we picked up in the animals and we knew that it caused a lot of damage in them. But till 2002, we did not think it came into the humans. Then we flu, obviously, type of a coronavirus, but we actually faced SARS to start with, and then which was the severe acute respiratory syndrome, and then MERS, which was Middle East respiratory syndrome, late in 2009. And that was the time we all knew, not people like me, but the experts knew, and they were predicting that somehow the SARS-CoV would come up, and we need to prepare. And that is why in United Kingdom in 2016, they actually ran a pandemic exercise all over the country. Unfortunately, not many lessons were learned and applied, otherwise you would have been in a better place. From then onwards, when we moved on to today, now we want to pick up on some signs and symptoms. And we also picked up that the signs and symptoms are quite variable. So obviously it lodges itself in the epithelia and then goes up down to the mucus. So basically in the nose and mouth, and then goes down the trachea, which is the airway down there. And then that is why the symptoms are quite variable. It is a multi-organ disease, we have to remember, but it tends to start with fever and a cough. So it's not very common to have complication without them. You can still have COVID, but the people who end up very, very poorly will start from this pathway. High fever, fatigue, breathing difficulties. And then what we also know that actually loss of taste and smell is also when actually the virus penetrates and destroys just under the mucous membrane. As Dr. Mozam kindly also mentioned that there has been a lot of fake news or propaganda, he used the word, has gone on from the very beginning. And when we started dealing with this, the first one was if I remember. I won't touch on it right now because just for the benefit of time. But if you remember, there was always this discussion going on. Well, actually, it doesn't exist. It doesn't transmit like that. It transmits from everything and everything. So one extreme to the other extreme, we were hearing. And people actually talk about WHO not being clear, or I have heard, even from the professionals, this argument, the WHO actually did not want us to wear masks from the beginning. Actually, I'm not sure about that, because if you look at the advice, they said the words they used where there was no evidence at that time. So they really wanted to get to some evidence before they advised the 7 billion people on this earth what is the right course forward. So in July 2020, there was a meta-analysis, systematic review of 172 studies looking at the experiences of transmission of about 500,000 cases. And that is when the real guidance came out. Well, the guidance was there, but now we know it was scientific based. And most of the studies had looked at minimum of 1 meter. But they also, the evidence for the bigger the distance, the better the safety. That is why United Kingdom went on to 2 meters, and many other countries like that as well. So we know that it actually goes through droplet, which means basically I cough and it is transferred. But if you have in a situation where in the air there is high viral load, for example, in intensive care unit, in casualties, things like that, it can be airborne and it can stay for many, many hours and people can get it. And that's why the safety is much more important there. And that is where the time in July, it was a very conclusive discussion that we really need to get face masks on. Same study looked at the other things as well. So the most important evidence was about the distancing. The second one was about the masks. And the third one, which was a bit weaker, but is still there, was about eye protection in high viral load. So like we in the hospital, when we are on COVID ward, we actually wear the glasses, which are different. At the same time, this has been another one. And actually, lots of people made a lot of business all over the world. They actually started offering tests for you. We will come home and do test you and we'll charge you only so much in Pakistan rupees, or in other countries, they start charging. We have to be clear scientifically that the best evidence has been for RT-PCR, which is basically the test which is you are asked to put a probe in your mouth to the back of the mouth, not just on the tongue or side of the mouth. You really have to go to the back. And quite often my colleagues will say that if you have not gagged, you have not got it right. And then you actually take it from nose, and that is what it is tested. It takes time, we know that, but it is much more sensitive. There are other tests which have been developed, and the commonest one which we also are seeing in the schools, for example, in my workplace in the hospices, we are doing that for the visitors, and the care homes, we have also introduced this lateral flow testing. So it gives a result within 20 minutes. So if you are not symptomatic, we do lateral flow testing, there's a strong chance that you would not be having it. But if you are symptomatic, then we wouldn't be doing lateral flow testing, we will be asking for PCR. So what do we do? The treatments. Now, it has been really a difficult journey for all of us. From the very beginning, first of all, like I remember when I got ill, the evidence for oxygen was very sparse. How much oxygen to give? When to start people on, there is another method which is called CPAP, which is a type of non-invasive ventilation, which the mask is put on the face. So when do we do that? How much oxygen to give? How to isolate? That sort of things, we were still working on it. I give very good credit to people like Peter Fumby and Oxford. They actually formed the recovery group. And they actually, in the recovery group, they actually went on to do a lot of arms. So there are very many different studies were going on at the same time. The first thing they came up, because it was very much sold on media and everything, about chloroquine. And we did not find any robust evidence for that. If you read the paper, it actually talks about that it can even cause harm, but with minimum benefit. You have to remember, because it's only 3 to 5% of the people who are getting ill. The question here is that if we are giving it, is it the placebo effect, or is it they were going to get better anyway? So that is why they needed a bigger study, and that is when the results came out. Dexamethasone is definitely, that's the one thing which has come up really well. But it is about those people who have dropped the oxygen levels really remarkably. And this is where we need to get it right for them. So it's in the hospital situation, and people who have had oxygen and needing this, you give them oxygen and then they get better. And there were other studies of the, not just here, but internationally as well. There was a lot of talk about enthusiasm about plasma, for example. And in Pakistan, I know that actually lots of people made a lot of money by giving plasma. Still, we haven't got any conclusive evidence for that. I will very strongly argue that if people are giving plasma, it's very easy to get registered with the centers who are actually doing the study. So we put all the results together and actually start treating it so that we have got robust data. There's another drug which is talked about a lot in the recent days, which is ivermectin. Ivermectin is an antiparasitic drug, and we are all talking about that it has got some effect on the messenger RNA, so we should be using it. However, again, we still are in the infant stage of working on that. And I'll come back to treatment when I talk about vaccine as well, the why it is hard to do studies on the treatments. Mortality, it varies very heavily. Some studies as low as 2.3% and then go to 14%. It depends on the population, it depends on the underlying cause, it depends on your other things which I have enumerated there. We know that smokers are much more affected. Manasa very wisely actually talked about the immunity. So we know that immunocompromised people are affected. Air pollution has got a lot to do with it. So we know that this data is already telling us these people are requiring at least more invasive treatments. Age, medications, pre-existing heart and lung disease, obesity, and pregnant ladies. But there is another thing which I will just take a pause here and I will say. So we can say that actually there's such a small amount of people who are dying. So why are we actually, other diseases can also cause that, this and that. The problem is that yes, there are the people who are younger than 70, the incidence for them dying is about 1%. But what we also have got this problem here, that 20% of those 1%, we do not know why they are dying or why they're getting long COVID. And that is what is the biggest fear, because what sort of healthcare burden we will have, not over the next 5 years or 10 years time, if we are not able to contain it. Are we looking at some sort of long-term lung disease or thrombus disease, like clotting disease, we call it thromboembolic. So we do not know that. And that is why we really want to be safe. And this is where we are. So we moved on from there to the current era when we have started talking about vaccines. See, and this is, the vaccine really fascinated me. And I'm not a very huge scientific person. I like those studies which are very much, I give this person A treatment, person B that treatment, which one works better. But that fascinated me big time. And I'm sure the people who are here are very, very knowledgeable people and they will know better than me about these things. But the digital mapping I saw and the future characteristics of the vaccine they could predict on the computer with the IT was really some futuristic science in front of me unfolding. So what they did is actually looked at which type of vaccine can help us. So we actually know that coronavirus has got mostly 4 proteins, which are membrane, envelope, nucleopeptide, and spike. And what we wanted to send the message is actually block one of them. Sorry, I don't want to be too much technical, but I got fascinated about this. So please forgive me for getting too excited. But messenger RNA to basically stop the multiplication of that. This is what the idea is. This is what Pfizer, or actually BioNTech, was the one who developed it first. A couple from Germany, which is a small organization, BioNTech, but they came up Trump with it. Sorry for the word Trump. Then we got Moderna. They again worked on messenger RNA. And more recently, we got Oxford AstraZeneca. That was a completely different type of technology they used, which was a weakened adenovirus, which they got from animal model. And they basically used it in a weakened form, and they saw how much antibodies and lymphocyte we can produce. All of them have come really well. So we are really hoping that somewhere we will go better. This is the difference between the studies on vaccine and the treatments. In vaccines, because you are really playing with the virus itself and the messenger RNA, you can predict the future digitally. So how actually your body will change. Whereas in treatment, when we give a treatment, it affects the liver and kidneys and everything. And that is why if people who are really, really unwell, it's very hard to do the study in a very short period of time. There are lots of mythical questions which have been involved with vaccines. And people have asked this question and working in different centers. I've been asked questions, and I'm sure on the social media and everything you have come across. I will leave it till later when of time. But important thing for us to remember is, I think it's on the next slide. The next slide is this. This one, and it's the last slide. So we have come on a journey where we have developed our knowledge on how does it affect the body, what treatment can help or not help, and where do we go from here, and how do we protect ourselves. Now there are all these questions asked. For example, recently we have heard about the new mutation. Internationally, we have found two different types of mutations. One started first time it was found in the Southeast United Kingdom, and the second was in South Africa, but they both were on spikes. However, the mutation were on the same type of area on the virus, which can be vaccinated. So we do not, the studies are quite clear that we are still targeting that mutation. So we should not be worried about mutation that it will cause. However, because it's much lighter, it actually transfers much more quicker. So we know that it transfers quicker, can make people ill very much, but when we talk about vaccine, it will still work on that. But because of this new mutation, and we know that it is multiplying very quickly, at least in the United Kingdom, we need to be comfortable and need to be safe and confident that we are doing it right. Maulana Sahab already touched on the vaccines part of it, that we should not be listening to the people. I would not take much time, but I actually take a lot of inspiration from my faith, where I've got a system in which I will go and ask the people of knowledge. 1,600 scientists, every living Nobel Prize winner, every huge academic name from Yale to Harvard to Oxford to Cambridge, they are coming up with something. And then there is our mates who actually just sit on the YouTube and make a video. I found a very funny one which said that actually on one, it's such a difficult decision to make. On one hand, I have got all these scientists. On the second hand, I have got Dave, my mate, who has got my favorite beer in his hand and is screaming, don't take vaccine. I do not know who to believe. So I think our faith gives us strong guidance to us to stick to the knowledge. So I won't take much of your time at the moment here on this. Where the future takes us. I think the future, all of us have responsibility. We should have a healthcare system. We have found out in the last year that those countries are caught out more where the public health and the preventive medicine was not as good as the places they were as good. So that people who have got that data, where they will control it much better. Yes, there were natural causes in which people were living in larger houses, larger places, and it did not multiply. But we have recognized our responsibility towards other people. We have got a responsibility to be healthy, to protect other people, to not disseminate the infection very widely. The last thing I will say, and this I would say quite often, is actually, as doctors, we all have a responsibility to read the medical evidence base rather than actually just reading the newspaper and the other things. There are more than 500 different trials and the evidence just in United Kingdom going on. Then there are other parts of the world, in Europe, in Germany, in Australia, in America, and other parts, Japan, China, where the good studies are coming out. We need to look at the statistical evaluation of it. And as doctors, I'm sure all of us will have some good eye. But we need to read those peer-reviewed papers, which are giving us good science. And that is how we can move forward. That will stop us from getting into the trap of fake news. We will be confident in our knowledge. So we will know that what it does, how can we prevent us, and how can we support our loved ones as well as general public. Thank you very much for your time.
Thank you, Kumar Bhai. That was really, really well presented, and a lot of things to take in and take home messages from there. So thank you for that. And I think you have touched on the new variant, and I think that's a really hot topic of discussion at the moment. And since this new variant has been found, we know that it's now being said that it is at least 50% more transmittable, which means it's at least 50% more contagious than what we knew before. So what that would mean is that more and more people are at risk of getting it. And that can obviously translate into possibly in the same proportion, more people getting more unwell, needing more hospital admissions, and obviously more serious consequences as well. But one good thing over there, which I think we need to mention here is, regardless of whatever is the new variant, the precautions, they stay same. And doing the same things which we have been told and we have been observing throughout this pandemic, which is maintaining social distancing, washing our hands, wearing face mask, and ventilation as well. So the precautions are still the same, regardless of whether it was previous one or this new variant. And I think with the time when it's a bit more, what we know now is that it's more transmittable, then I think our responsibility as an individual, as a community, has increased, that we try and follow these precautions more strictly. And now, as the government in the UK is saying now that unless proven otherwise, you consider that you might have it and just follow the precautions accordingly so that you are not putting yourself as well as other people at risk. So I think that's a very important point here. And with that, I think we have some question here. Okay, so I think we'll come to this question a bit late.
I think there are a couple of questions in Q&A as well as chat. Do you want me to take them or later?
We'll just ask Dr. Zainab for a quick overview of how things are in her end, and then we'll just come to questions. So
Thank you very much, Dr. Mozam and Dr. Syed Kamar, for the introduction. So I basically belong from Germany, and my topic today will focus more on the vaccines, as we discussed. So I'm a trained hematologist, and I also practiced immunology in the Bristol Institute of Transfusion and Transplantation Sciences. At the moment, I'm more engaged into the research related to the viruses and also the impact of COVID-19 in several countries. I'm involved directly as well in the vaccine related research, as well as the tests that we just talked about related to the virus, whether it is a PCR test or an antigen test or an antibody test. So I will focus on the topic of vaccines, and I will try to explain it simply so that the people who are here, they can also ask questions and they can understand more about the vaccine dynamics. So at the moment, we have 3 vaccines that are there in the world, in US, in Britain, and also in the European Union. We all know that the Europe, including UK and US, have been hardly hit by the virus, and especially the new strain of the virus, which has been identified in UK and also in South Africa. This strain is coming out to be more transmissible. So this is a point of concern for all the countries which has already identified this type of virus in their community, because it is getting a fast spread. So point number 1 is the new strain of the virus. So I would be happy to take any questions about it. And the point number 2 is about the 3 types of vaccines that are currently being used in US and in UK and also in Europe. So we have Pfizer vaccine, which is a combined approach of Pfizer and BioNTech, which is a German company. It's a messenger RNA vaccine. It's genetically engineered RNA vaccine, which has the safety of around 95%, and it can be given to people who are 16 years plus age group. And it is safe to almost 95% in both male and female population. The second vaccine is from Moderna, is another Spanish group. Actually, the same type of vaccine, messenger RNA vaccine, which uses the genetically engineered material, which is injected as a copy of the DNA. And there was a question whether this DNA is incorporated by Dr. Ijaz, that a lot of people ask, if you put a DNA or a viral genetically engineered vaccine, does that DNA stay, or does that, do something with your own DNA? It doesn't happen this way. This vaccine initiates a response in which the body produces proteins, similar proteins like the viral proteins, and we get antibodies which are protected, which are providing protective immunity to us. And then that vaccine impact, or the protein of the vaccine, gets destroyed in the body. So it doesn't stay. So there is no evidence which says that it impacts our DNA or it impacts our germ cells or something like that. So we have to clarify this myth to people who have this question. The second vaccine, Moderna, is also equally safe, and it works on the same principle. It can be used by all the adults who are 18 years of age and plus 18 years of age. And this is also widely being tested. And I will be happy to answer questions if anybody has related to the testing of the vaccine or the safety of the vaccine as well. The third vaccine is Oxford vaccine. It is a different type of vaccine. When we use vaccines, we have different ways of formulating vaccines. Mainly, there are 5 ways. This vaccine is an inactivated virus, and it's a very common way of making vaccines, like we have other vaccines also developed in the past. And it's a very safer way of making vaccine as well, when you inactivate the virus and you make the vaccine so that when you put the vaccine into the body, it initiates the immune response, but the virus is inactivated, so it's completely safe. That vaccine has also been tried on a large group of people. Also, it has been trialed in several countries with several ethnic population involved, and it has also come out with very good results. So all these 3 vaccines are widely being used in certain authorization in different countries. In US, they have a different system of authorization. In Europe, we have a different system. In Germany, it's a bit different as well. And in UK, you have the 3 vaccines. Recently, it was announced that the gap between the dosage of the vaccines is extended. So there are 2 doses of the vaccines that are being used. So the first dose is given targeting certain tiers of population based on the fact that it impacts the more elderly people, or the people who are more close in proximity to treating the COVID-19 patients. So based on the priority groups, the tiers have been made in different countries and people have been vaccinated. So the first dose is given, and after which the second dose is being planned as well. So in UK, I believe 7 million people have already been vaccinated. In Germany, we have also good numbers, around, I think, 700,000 up till now, although we have 1.8 million infections here. The gap between the dosage has been extended to improve the prioritization of the vulnerable groups. And also it has been scientifically checked by several European agencies that whether the gap between the 2 dosage can be increased or not, and how does it help the general healthcare system. So in the market at the moment, the 3 vaccines have been in use, and the first doses have been given to a large group of population as well. So I would be happy to take any questions. So there is a question from Jumana of somebody who has taken the vaccine. So Dr. Muazzam and I think Dr. Syed Qamar can also answer them, because they have already been vaccinated, I suppose, recently.
Yeah.
So thank you very much, everybody. And I would be happy to take any questions you may have about your vaccine appointments or your information that you need about the vaccine, or if any clarification you need related to the safety of the vaccine, I want to make sure that our community knows that these vaccines have been trialed on more than 50,000 patients, sometimes more than 40,000 patients, depending on the trials. And these trials have included people of all the age groups. There is some variation between all the 3 vaccine trials. If anybody requires that information, we will be glad to discuss that as well. But they have been trialed on the male and female adult population at the moment in thousands of people. And they have come out to be safe with minor side effects, which we normally get when we get vaccinated, like pain at the injection site, or rash at the injection site, or redness at the injection site, or some mild fever, or slight headache, or slight fatigue. So these are the symptoms that we normally get when we get vaccinated from some other vaccines as well. So we have not come out to have severe side effects. I won't say we have not, but it is not at the level that can put us in danger or that can worry us. So the levels of serious adverse events that we have seen in the clinical trials are within the safety data limits, I would say, as compared to the other vaccines as well. And therefore, the community should not worry about the disastrous impact that people are talking about or something like that. These vaccines are very safe. They have been tested on a big number of people. Even in the high-risk groups, these vaccines have been tested, especially the Moderna vaccine, and the data is quite promising. So I would request all the people, in order to save yourself and your families and your community, it is our duty to make sure that we get vaccinated. In case we require more information, we should clarify our doubts from our healthcare professionals, but we should not spread information which is not clear, scientifically authentic, but trust your healthcare providers and your healthcare regulatory agencies. And we are happy to answer any questions you may have related to the vaccines. So thank you very much, Dr. Mozam and Dr. Kama.
Thank you, Dr. Zainab. You have made some really good points. Just want to add a few points before we move on to questions. So in UK, the data we have so far, 1.5 million people have been vaccinated. And it is expected, according to plans, that by mid of February, we are expecting about 15 million people to be vaccinated in top high 4 priority groups. And that together with the precautions and the guidelines given for social distancing and hand washing and wearing masks would help us to bring some sort of movement towards normality in our lives, inshallah. As you have mentioned, there was a question and a comment about the DNA and the mRNA vaccine. So just a quick point on that. And so DNA, so this is something which we keep hearing every time and again. So DNA is actually in the cell. DNA is in the nucleus, which is the center of the cell. And this mRNA, which is messenger, does not reach the nucleus. It just takes the message, leave the message, and the rest of the immunity process start. And the way that nature has designed this get destroyed, this mRNA, and does not get involved in anything else. So it does not reach nucleus, which in simple words means that it does not reach your DNA. So once it can't reach DNA, then it can't alter it or cause any problem. So the other thing about the vaccinations, so yesterday we heard that there were more than 1,300 deaths in UK, and there were more than 1,000 deaths today as well because of COVID. But alhamdulillah, we have not heard about a death because of vaccination. So I think that's very important to see and compare as well. So we have got a few questions here, and I think one of the question I would take it to Kamar Bhai about having the vaccination in somebody who had COVID, and after how much time period of testing positive they can have the vaccination.
Thank you. The guidance state is 4 weeks after you have been diagnosed, then after that you can have it. But also what you need to remember that actually when we talk about the side effect and for example, headaches and like body stiffness and body aches, that could also be positive in those people who have just been diagnosed in the last few months to have COVID. Why? Because you already have got antibody load in your system, plus you are having this vaccination. However, it's not harmful. I personally, as I said, I had it. I actually had my second dose yesterday, Pfizer BioNTech. So, so far I'm still sitting in front of you, so I haven't collapsed yet. So I hope that gives you some confidence. The one question which is which is very interesting, and maybe Dr. Zainab may want to take it, but this is a very interesting one, which has come out about why we are actually giving it longer than 21 days. What we already know that actually the data was collected on 21 days for Pfizer BioNTech. For Moderna, it was 28 days, whereas for Oxford AstraZeneca, it was for a few months as well. You can have a gap. But you're right, actually, the data we already know of is on 3 weeks. We do not know whether it wears off or does not wear off because the data wasn't collected. There is a theoretical statistical possibility that it drops down. And that is simply based on the statistics rather than clinical observation. Dr. Zainab has been involved in vaccine trials, so she will know better. But that's what we have seen, the statistical data rather than clinical data. But the honest answer is that we do not know what will happen after if we do not have in 21 days. However, they're hoping that they will try to get as much people like Dr. Mozam kindly said that 15 million people we are aiming for. 21,000 so far have had second dose, me included, and 1.2 million people who basically had only one dose so far. There's another question about will we need another vaccine for new variant? The simple answer is no, because it has already on the second variant, it has been tested, and Pfizer BioNTech was the one which was tested on it, and they felt the preliminary data is out which says that it works on that. And then another question was about the children, that whether the children will need under 16 years of age. I can try to answer this question, but maybe Dr. Zainab would like to take this question.
Yes, Dr. Kamar, you can answer. It's okay. I can add something if it is required.
Well, again, I'm not a scientist, and I'm just taking my lead from my clinical colleagues and the colleagues, and I'm told by them, and like I said, you just follow the people of knowledge, and they have said that it actually is quite effective in children as well. That's all I know.
So the authentic information is that at the moment, all the 3 vaccines have been trialed on the adults. So what we can say with evidence is that it is very effective in adults. But at the same time, when the vaccine trials are being taken, several small studies have already been started in the pediatric age group in the European Union, and I'm sure in the UK as well. And those small studies have given the data that it is not coming out to have any detrimental impact on the pediatric population as well. But before we say that it is approved for use in the pediatrics, we have to look for the authorization process to be done by the vaccine manufacturers, because there is a process of getting the marketing authorization, and this will take some time. But the evidence which is coming right now is quite promising. So I hope that we would have that for children as well. But at the moment, no. At the moment, these 3 vaccines are only indicated in the Moderna, and the Oxford one is for 18 years plus, and for the Pfizer one is 16 years plus.
Thank you, Dr. Zainab. Just a quick point which I want to add, and I think that will answer one of the questions which just been posted now. So, so for those who had COVID, will they need vaccine? Yes, this has already been answered, because we do know from some evidence that the people who had COVID, they still can get it again. How much immunity they can develop after getting infected first time, this is still not very clear. This is still something which is currently under review, and obviously with the time we'll get more evidence and more information about it. But what we know now is that they still can get infected. So yes, they will need the vaccination. I just want to add a question here, which Dr. Zainab, you can probably answer because you're involved in clinical trial. One question people ask quite frequently is, it takes years and years for vaccines to get developed, and that's what we have seen historically. Why this time this has happened so quickly?
So the vaccine development process takes years. This is true. But for the pandemic situations, there is a special process in which more resources are allocated, point number one. And point number two is that there is an emergency or conditional authorization which is given by looking at the situation of the world and the need of the world as well. So there has been vaccines in the past also. It has not only happened with COVID-19, just to clarify to people. It has not happened with the only vaccines. It has happened to certain drugs and certain medicines also, in which the authorization is given due to an emergency situation or due to a pandemic situation. But that authorization is known as emergency use authorization by FDA. And in Germany, we call it conditional authorization. And in this conditional authorization, the authorization is given, but please remember the fact that even after giving the authorization, the companies are asked to submit the missing data, and they are also asked to continue the trials for the next 2 to 4 years, depending on the data that they have already given. And the safety profile of the vaccine is continuously being monitored. So for example, in Germany, we monitor it from Paul Ehrlich Institute, and we have a process for it. And the European agencies are taking the safety data of the vaccines, and they are looking at the impact of safety of the vaccines. So emergency use authorization not only happens with the vaccines, but sometimes it happens for the drugs as well. But the trials are ongoing. They will continue to collect more data. They will continue to collect more safety data of certain populations, certain age groups, like pregnant women, children, immunocompromised patients. The data is still coming, and it will continue to go on till the full authorization will be given.
Thank you. I think there are a couple of questions which probably could be addressed together. They probably link with each other, and I would like if Kamarbhai can answer that. I think I had a bit of discussion about this with Kamarbhai, that people are saying that when do we expect to come out of this pandemic? And it is a question, if children are not going to be vaccinated, how do we expect to come out of this pandemic? So I don't think any of us can give time frame that when we can come out, but we probably can touch on things which we are doing and how we see that they would gradually help us to come out or get some sort of normality back.
Thank you. I think we are still learning a lot about COVID. We are still learning a lot about the SARS-CoV-2 virus, and it will take time for us to understand it fully. What we have learned from the previous pandemics is actually the virus actually goes through a particular cycle. And if I can use a very slang word, that it starts losing its teeth, because people start developing it starts getting a bit weaker, or people start getting a bit stronger against it, like Spanish flu we have seen, or in the SARS, which was in early 2000s, we saw, or the MERS we saw. So our hope is that we will have the good measurement of the prevention at the moment. At the moment, the virus still has got a lot of teeth, and that is what is coming to hunt us. And that is why we need all these measures. We all need vaccination, and we all need to go through it. However, when will it go? It's very hard to say. Quite often, for example, if you look at influenza, it had become usually an epidemic or endemic. So it actually still spreads out in an area, but it still stays in that area. How the world will get to normal, again, very hard to say. I think the people who are epidemiologists, they are actually creating reports every now and then, and you will read them. That's what the model is. This is how it will reach the first wave, and second wave, and third, and the fourth wave. How will it actually affect the people? But they're all calculated measures. We still do not know how will it behave. We were expecting the second wave in UK to come around November, end of November, early December time. But we now feel that it will be now till end of January when the second wave is going. So it will get popular. So we do not know when will it go away. We still want to measure everything which we can protect ourselves and other people. And what we are hoping that people will start developing either through the vaccination or generally on natural immunity, and the virus will start going away. That's sort of hope.
Thank you. Dr. Zainab, did you want to add something to it?
So the good news is that vaccines are being developed by several companies. So I want people to know that the vaccine development process is ongoing. So it is a good hope for us to stay motivated that this is going to end. This is what I can say based on the companies that are making the vaccines and the rate at which the vaccine development is going on. This is one good news. The second good news is that what Ijaz has written in his comments also from Germany, that so many people have been vaccinated and kind of protected. Although it's a short-term immunity at the moment, we don't know how long the immunity will last, but at least they are being protected. And if you look at the numbers of people who have died, surely it's a very reassuring number, the people who are starting to get the protection. So till the time that the vaccines are being developed and they are being tested and they are being given to people and the more data comes out, we cannot estimate at what time it will end. The only thing that we have to pray and also religiously with our beliefs, we keep praying that the variants that are coming out, which are those variants. So there was a question about the variant. So I want to explain it a bit. There are two variants of this virus that has come out. One is the Kent variant and one is the South African variant. So the variant which is in UK and in South Africa has more transmissibility. This is true. But there is one form or one mutation of the variant, which is a bit alarming or concerning for us as scientists, because that mutation is doing some shape changes in the spike protein. Although this is something which can be preventable also by the vaccine, but we all in the world are trying to see the impact of that variant as well, because that does some impact on antibody production as well. So we still have to see how the virus evolves. But at the same time, there are resources in the world to revise vaccines or modify vaccines, which has happened in influenza also. And that's a quick process. So it doesn't take much time. So please stay hopeful that the situation will hopefully going to improve. But don't forget that the hygiene precautions, the mask precautions, and the social distancing precautions will stop. We have to make sure that even if we are vaccinated, we have to follow these precautions for a certain period of time till we are very sure that we are not transmitting the virus. There are myths and there are some news also that when you get vaccinated, you are not transferring the virus anymore. So yes, there are some studies going on to see if you are vaccinated, are you able to transmit the virus or not? So there are some vaccines like the Oxford one, or there is another one, which has given some good data that the transmissibility is also reducing, but still it's not confirmed. It's not being released at the moment. So we have to continue taking precautions even if we are vaccinated.
Thank you, Dr. Zainab. Just another point on the point of new variant. I think I will just add that the mutation or getting a new variant is not a new thing. In the multiplication process of viruses, and typically a bit more in this particular type of virus, which is an RNA virus, when they are multiplying, sometimes some problems can occur during the process of multiplication. And that simply causes the alteration in their structure, which is a mutation, and they form a new variant. And forming or having a new variant is not always a very alarming thing as well, because sometimes they do not change the characteristic or their transmittability or the infectious nature of the virus. And sometimes it can be changed. But this particular type, which was found in UK, what happened was there was about 17 alteration, and which has made it having that much high transmission rate. So that's one thing. And again, in terms of, I would just like to emphasize again on this point, which I've said before as well, that our responsibility stays same, and in fact, even more than before. So that's the only point I wanted to make about the variant. And I think Dr. Ijaz has made a very good point in the chat, which Dr. Zainab has discussed as well about I think it's important for us to understand that there's no medicine or no treatment which exists that does not have any possible side effects or complications. We go and buy paracetamol, ibuprofen, simple medications from markets, we take them. They all can have some possible side effects, possible complications. So there's nothing which exists there which cannot have any possible side effects or complication. And same implies to vaccination as well. If we go up a bit in the past about vaccination, they have been a very tried and tested method of providing immunity and saving lives. According to WHO data, what we have is about 3 million lives are saved each year from the available vaccines, which is a huge number if you think about it, what they have been doing for saving lives. So it's not a new thing. They have been there, they have been tried and tested. And in every country where the vaccines are being rolled out or have started already, they all have their own regulatory authorities. For example, in the UK, we have MHRA. In America, we have FDA, or in European countries, they have their regulatory bodies. They go through a stringent process where they check the efficacy as well as any possible complications and problems that can arise because of the vaccines. And once they are satisfied, then they allow them to go out in the community or for the people. So I think that's quite reassurance. We, like it was said before as well, this is somewhere we need to have some trust in the science and as well as the people who are responsible for all this. Are there any more questions?
So I would like to take question from two ladies. Not that I'm a woman, but I can see that they are asking about the children. So
Sure.
I would like to answer those questions because I think for mothers, this is important. So there is one question about the 8-year-old child with asthma, and Dr. Fatma has asked this question. This is a concern for a couple of people I recently also heard who has children having asthma or, obstructive pulmonary diseases. So Fatma, you have to wait. It's not that the data is quite promising for the children, because I have myself seen the data which was coming out from the German group. And there is another group which is doing 2 multi-country studies. And the pediatric data is coming out to be really good. And the vaccine providers have been asked to submit that data eventually. So they are working on it. And as soon as enough data is developed and provided, I think the marketing authorization process will go on covering that age group as well. But a child having asthma doesn't, I personally think, being an immunologist, 2 points I want to make is, if somebody has children, the children are not prone to get infection or a very severe infection. So we have to be very clear about it, that the data which has come out from this disease has proved that children are kind of naturally protected. They do not usually get a severe disease, one thing. And there are scientific reasons about this. I'm not discussing those reasons right now, but there are scientific reasons related to their immune response. There are scientific reasons related to their previous vaccinations as well. The children, when they get vaccinated, when they are born. So there are reasons that are involved in a different immune response of the children. So children are quite protected than us. So the data says that. So we have to trust in that data and do not get worried about the children at the moment. Even if they are having asthma or some disease, we want to make sure, what you can be sure is that you protect your child from getting, not maintaining distance, or not wearing a face mask, or these things. I think, and I can assure you that the more you do that protection, your child will be protected. And as soon as the results will be there, I hope that we would be able to get the vaccine for the pediatric patients and also for the pregnant women.
Thank you. I think Kamarbai, you wanted to add something.
Yeah,
So
I think, sorry.
yes, Kamar bhai.
Yeah, I think, I mean, apart from the vaccine and the treatment, we are talking a lot. I believe most of us are doctors. I think there is another spectrum we always need to look at, is also the psychological well-being. I think in the last, obviously since the pandemic started, we all have been frightened and anxious and worried, and going, and especially the way, I remember actually one day when in the hospital, we had like actually 40 deaths in one day, and who were under my care. Obviously, end of life care. I had to, and the things were not working out. Whatever the treatment protocol we were trying to use for their breathlessness, so it was quite worrying time for all of us. As doctors, I think we have done a really good job is taking the leadership here on and head on. I honestly feel we all still need to keep on working together on our own emotional well-being, on psychological well-being, following the science. And Dr. Zainab has given such fantastic views on these things, on vaccination, and from religious point of view, Dr. Abbas was saying the same. I really hope that as a moment, whose best weapon is a dua, we really need to stick to it and really need to provide that leadership to our clinical colleagues, our families, our friends, our community to move forward. Otherwise, it will be really a difficult time. So when we are worried about when will it go away and how will be, at the same time, we always live with hope and that prayer that actually will take us forward. Because if it has helped all of us till now, inshallah, it will keep on helping, and we will keep on guiding other people. So we need to be mentally and emotionally strong to provide that role as well.
So Tehmina has written a comment which is related to your answer, and I want to add to that. She has written that, is it possible that this virus will go away from this world, out of pandemic will be out? So I want to give a small hope here to people. And Dr. Saab has already mentioned in 2002, it started with, the similar viruses, MERS and then SARS. So they started to develop vaccines for those infections as well, even for MERS. And the vaccine reached the stage 3, and then the virus was gone from the community. So viruses mutate, they evolve, and there is a possibility that during the mutation, they sometimes do things that they can kill themselves as well. So we don't know. We can pray that either the virulence reduces, we can pray that the virus, disinfects itself during evolution, or the virus loses its capacity to infect us and go somewhere else. These are evolutionary changes, but they are possible. This has happened with some viruses as well. And maybe after 4 years, we are not talking about COVID. This is also possible. So we should keep praying that may Allah help us and prevent us from the evolutionary impact of the virus, and it doesn't harm us anymore. And this virus can be eradicated as well. So keep your hopes and your duas high, I would say this.
There's a question, I think Kamarbai, you touched on this in your presentation. Please, could the alternative antibody injection be explained and whether it is being administered in seriously ill COVID patients as part of their treatment? Although, I mean, these are more about the treatment as an inpatient and may not be something most people would really need to know, because sometimes in our experiences, things do create a little bit of confusion, but because it's a question which is asked, so I would ask Kamarbai if you want to address this, please.
Sorry, I was just busy responding to another one which talked about Ayatollah Sistani's view on vaccine. So I've just copied and pasted the link of Ayatollah Sistani's view on the vaccine there as well. So inshallah, that will help all of us. In terms of treatment and whether we can give antibody treatment, again, studies are ongoing, but so far we haven't had much of a positive response yet. That's not to say that it will not come out later. It might be, but antibody injections, we do not know, because the simple thing is, and again, Dr. Zainab will know better than me, is the antibodies, while extracted from the body, has got a particular life, and how does it transfer to the patient's body, and how does the person responds to it. That has got a huge impact on all of this. So far, if you're talking to me about the evidence of the treatment, no, we do not have any evidence. That does not mean the studies should not continue going on. There are lots of studies. Any doctors who are doing that, I can send them the links of the studies on ivermectin and antibodies and plasmas, so they can actually connect with those central studies and produce the data very quickly for an answer. So far, no. The answer is no.
I think Dr. Ijaz made a comment and say if Maulana can answer that question. Maulana had to leave for another program, so Maulana is not with us at the moment. But I think Kamar Bhai has shared the link already from Abbas Sistani's website, so people can have a link. Are there any more questions?
So we will need another vaccine for the new variant. There is one question, and maybe Dr. Saab can also clarify that.
So I think that's already was answered.
That is done.
What we know so far, that these vaccines will cover the current variant. Is that right, Kamar Bhai?
Yeah, I think the last question, which I'm just seeing, is about, are the clinics going to get supplies to inject patients in Canada? I'm afraid I'm not an expert on the Canada. I can tell you how the vaccine is being disseminated in the United Kingdom because of the contacts and everything I've been involved with, but I really won't be able to answer any question about Canada. Sorry, I don't want to give any misleading answer.
No, exactly. I can't answer that as well. If you have any attendees from Canada who are in position to answer, being a medic, then they're more than welcome to answer as a comment, or if they want to say something, they're more than welcome. So if we don't have any questions, can I just say if there are any final comments you want to make before we close? We'll start with Dr. Zainab first.
So thank you very much, everybody, for providing us the opportunity to talk about it. And I want to reassure the community, the mothers, the fathers, the sons who are here, who are listening to us, that we as medical professionals, we are trying our level best to help you, to educate you, and we request you to please get in touch with your healthcare providers in case you have further queries. Please look for more authentic information, and unless the information is authentic, do not pass any rumors. Help people who needs help at this point, because our religion also teaches us that people who are in quarantine, because I was myself in quarantine, people who have small children need help at this pandemic time. Try to help people and try to stay safe, and keep your children safe, and we hope to meet with you with a better world in some time. Thank you very much.
Thank you. Kamar Bhai.
Thank you. I think Dr. Zainab has said everything which needed to be said. So very nice closure of the whole discussion. I obviously, nature of my job, when I look after end of life care, you talked about quarantine and people getting very much lonely and getting in difficulties. One of the issue in the United Kingdom, and I know that in some other countries, has been about the visiting of the patients, that we are not allowing the people to visit the patients in the hospital. And sometimes they've got a huge bearing, especially if the patient is dying. And there is no easy answer to that. But I think all of us, we need to mentally and psychologically make ourselves strong to support each other. We need to come out of it strong, and we will come out of it strong, inshallah. Allah and Ahlul Bayt Tahirin will give us encouragement to come out of it. I don't want to bombard you with all the information, but when I got COVID, and I remember in the middle of the night I had to text, because at that time even the funerals were not happening. So basically, I had to text somebody to say, well, actually, what will happen if when I go? It was like 2 o'clock in the morning, and my oxygen saturations were dropping down very quickly. From then we have come a long way. But also the duas, and I would suggest that we finish by doing a Surah Fatiha for any mu'min or mu'mina who have passed away during this pandemic with Thriful Allah. And please keep ourselves safe, keep ourselves protected, not just physically but mentally. But please remember those people who we have lost in the last year due to COVID.
Thank you. And I think, Kamarba, you and Dr. Zainab very, very beautifully have summarized the things here. I just want to add that we all know that the health system in UK and pretty much everywhere is overwhelmed. Hospitals are busy, they're getting more and more busy, they're getting full. But I just want to emphasize a point here, because some of the work I do, we do see that at times people tend to ignore their problems. For example, we have seen some evidences that people, apart from COVID, they have got some other problems, but because they think that because the system is so overwhelmed, doctors are so busy treating COVID, or are they going to get COVID if they go to see their doctor or they go to hospital, they are ignoring their problems, which could be something to do with the heart, or we know that the cancer diagnosis have been missed as well. So I would really emphasize on this point that please, 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 regardless of how busy is the system, if you have any health problems, whether it's a bit of chronic problem, which you think you need to discuss with your family physician, your general practitioner, or you think you have a health emergency, which is not even COVID or COVID, you still can access the health system, and which is very important, because what we really don't want is that people miss or we miss any diagnosis, any significant diagnosis, just because system is overwhelmed. So please do access the healthcare system if you need to. And like it's already been said, that this is something which we can together come out from this pandemic, helping each other, following the precautions, getting ourselves vaccinated to obviously prevent illness for ourselves and also from spreading it as well. So this is something which we can only do together and help each other to come out of it. So at the end, I would just like to thank you all for joining, and especially Dr. Zainab and Dr. Kamar Abbas, Maulana Saab, Maulana Syed Abbas, Naqvi Saab, and our sister Shifa from IMI headquarters, who has always been very helpful in arranging this program. So I would like to thank you all, and thank you to all the attendees as well. If you have any suggestion for any future programs, you can make some comments on our Facebook page of IMI if you want any topics to be covered in the future. So thank you very much, and inshallah with this we will close this webinar.
Thank you. Bye.
Thank you. Jazakallah.
Jazakallah.